Welcome to Roadmap to Residency, Evidence-Based Applications. In this video, we will be discussing about bacterial virulence factors and bacterial toxins. I am Abhiraz and welcome to our Club 250 Matchmaker sessions. So here, first we have a question. Which of the following bacteria produces a toxin that is most similar to the one detected in this patient? A 6-year-old, previously healthy girl is brought to the office due to diarrhea and abdominal pain. The patient started having watery diarrhea after a barbecue she attended 4 days ago. Her stools became grossly bloody 2 days later. Her mother also had similar symptoms. Temperature is 37 degrees Celsius. The abdomen is soft with mild generalized tenderness. Stool culture performed on sorbitol McConkey agar shows sorbitol negative colonies with biochemical properties of E. coli. Enzyme immunoevasion detects an exotoxin capable of inhibiting protein synthesis in human cells. Which of the following bacteria produces a similar toxin to the one detected in this patient? Clostridium difficile, Pseudomonas aeruginosa, Salmonella typhi, Shigella dysentery, Staphylococcus aureus, or Vibrio cholerae. Now, we first discuss about the first year review of the bacterial virulence factors and toxins, and then we again return back to our previous question. So, talking about bacterial virulence factor, now these promote evasion of host immune response. There are 4 different and most important bacterial virulence factors. Number 1 is capsular polysaccharide. Now, these are highly charged hydrophilic structure, and these act as a barrier to phagocytosis and complement-mediated lysis, which is a major determinant of virulence of many bacterial organisms. Protein A binds the Fc region of IgG and they prevent opsonization and phagocytosis, which is typically expressed by Staph aureus. IgA protease is an enzyme that cleaves the IgA, allowing bacteria to adhere to and colonize the mucous membrane. You know that IgA is generally present in the cyanopulmonary sites or in the mucous membrane site, and the bacteria that invades or that cause diseases in these sites like Streptococcus pneumoniae, Haemophilus influenzae, and Neisseria, they all have the enzyme IgA protease. And this IgA protease cleaves the IgA antibody and makes the environment favorable for the bacteria. Talking about M protein, now this M protein you have heard as a molecular mimicry that is generally seen in case of group A streptococci organisms, and they help prevent the phagocytosis, and they have the sequence homology with human cardiac myosin, and it is an underlying cause for acute rheumatic fever. Very important concept of M protein, very frequently asked in the examination. Now, these are the main features of exotoxins and endotoxins. So talking about exotoxins, which can be produced by both the gram-positive and gram-negative bacteria, but endotoxins are produced by the cell membrane of most gram-negative bacteria. The thing about exotoxin and endotoxin is that exotoxin is produced by the bacteria, whereas endotoxin is when the bacteria dies, then these toxins gets released from that bacteria when the bacteria dies. Okay, now that is the most important difference. Now, exotoxins are generally polypeptide, whereas endotoxins are lipopolysaccharide, okay, or lipooligosaccharide, which are the lipid A component. Allocation of genes are present in the plasmid bacteriophage in case of exotoxins, and it is present in the bacterial chromosome in case of endotoxins. So exotoxins have a high toxicity, whereas endotoxins have a low toxicity. That is the fatal dose on the order of hundreds of microorganisms. So there are various effects of exotoxin and endotoxins. We will talk that in the upcoming slides and videos, and we have also talked some of those causes and effects in our previous videos too. The antigenicity is that the exotoxin induces higher titer antibodies called as antitoxins, whereas endotoxins are poorly antigenic. That's why these cause an immense amount of immune response, an immense amount of virulence, and there is generally sepsis in case of endotoxins. So toxoids can be used as vaccines, whereas no toxoids are formed, and so no vaccine is available for these sort of organisms. So the exotoxins are destroyed rapidly at 60 degrees Celsius, whereas endotoxins are stable at 100 degrees Celsius for 1 hour. So the typical diseases that or organisms that produces exotoxins are tetanus, botulism, diphtheria, or cholera, whereas meningococcal sepsis for gram-negative rods can be seen. Here we can see that exotoxin is produced by the bacteria. Then there is the downstream cellular reaction when it binds to the host cell, and whenever there is endotoxin, whenever the bacteria dies, there is release of endotoxin. This endotoxin bind on the receptor, and there is inflammatory response. Now, these tables are very, very important. So very frequently, the questions are asked from these specific organisms, the toxins are the mechanism. So please pay attention. Corynebacterium diphtheria produces a diphtheria toxin, whereas Pseudomonas aeruginosa also produces exotoxin. Okay, now these all organisms that you are seeing on the slides, they all produce exotoxins, and these the Corynebacterium diphtheria and Pseudomonas aeruginosa, they inactivate the elongation factor 2 through ADP ribosylation. Please remember these lines because these are the specific words that will be present as options in your examination. So pharyngitis with pseudomembranes in throat and severe lymphadenopathy can be the manifestation, and they can also cause myocarditis and host cell death. Talking about Shigella and enterohemorrhagic E. coli species, these produce cigatoxin, and they inactivate the 60S ribosome by removing the adenine from RNA. And then they can damage the GI mucosa. They can cause hemolytic uremic syndrome, and another is that the toxin that produces the increases the fluid secretion in case of enterotoxigenic E. coli, which can be either heat labile or heat stable toxin. Now, the heat labile toxin, they overactivates the adenylate cyclase, that is increase the CAMP, and they can increase the chloride secretion in the gut. And whenever there is increased electrolyte or increased chloride or increased osmosis or increased osmolality in the gut, then ultimately it draws water inside the gut, and so it can cause watery diarrhea. Also, we can see that the heat-stable toxin overactivates the guanylyl cyclase, and this decreases the reabsorption of sodium chloride. Again, if there is more salt in the gut, there will be more water that is there. Talking about Bacillus anthracis, it produces anthractoxin, which mimics the adenylate cyclase, and they are likely responsible for characteristic edematous borders of black scar in cutaneous anthrax. Vibrio cholerae, they produces the cholera toxin, and they overactivate the adenylate cyclase that increase the CAMP by permanently activating the GS protein and receptor. So it can cause voluminous rice watery diarrhea. So all these toxins increases the fluid secretion. So all this will cause watery diarrhea. Now, there are some exotoxins that can inhibit the phagocytic ability, which is typically produced by Bordetella pertussis or pertussis toxin. They can cause whooping cough, and they act by activating the adenylate cyclase by inactivating inhibitory subunit GI. Here we have the stimulatory subunit GS. So inhibit the release of neurotransmitter can be done by titani and botulinum. That's why they can cause CNS manifestations like spastic paralysis, rhizus sardonicus, for example, in case of infant botulinum, this can cause injection. This can be to injection of sports. So foodborne botulism is caused by injection of performed toxin, example from canned foods. Now, these are some of the other bacteria that can act by exotoxin by the lysis of cell membranes and by superantigens, which can cause shock. So lysing of the cell membrane can be caused by Clostridium perfringens or Staphylococcus pyogenes. So the C. perfringens produces alpha toxin, and these are the lecithinases that degrades the tissue and cell membranes, whereas Strep pyogenes produces streptolysin O, which are the protein that degrade the cell membrane. Talking about superantigens causing shock, Staphylococcus aureus and Streptococcus pyogenes. So Staph aureus causes toxic shock syndrome, TSST1. So it is called toxic shock syndrome toxin, which generally causes toxic shock syndrome with these features. And the thing is that both of these toxins, they cross-link the beta region of a T cell receptor to MHC class 2 on antigen presenting cells outside of the antigen binding site. So they cause overwhelming release of the inflammatory mediators, which can proceed to shock. Talking about endotoxin, endotoxins are generally the lipopolysaccharides found in the outer membrane of gram-negative bacteria. They are composed of O antigen plus core polysaccharide plus lipid A. This area have lipo-oligosaccharide. Released upon cell lysis or by diving cells by blebs detaching from outer surface membrane. And there are three main effects. They causes macrophage activation, complement activation, and tissue factor activation. So this endotoxin can cause edema. They produces nitric oxide, which can cause vasodilation. So there is hypotension, which can cause disseminated intravascular coagulation or death. And it is produced by the outer membrane. Activates the TNF alpha, contains O antigen, lipid A, extremely heat labile, and can cause shock. Now, you may see this chart in your first aid, and you may uh, unknowingly exclude this chart from study. But this is very important chart, and many questions are framed from this chart in your real examination. So, endotoxin, the lipid A component, it can cause three things, as we have talked earlier. macrophage activation, complement activation, or tissue factor activation. Now, this macrophage activation is through interleukin 1, interleukin 6, TNF alpha, and nitric oxide. Interleukin 1 and 6 may cause fever, TNF alpha causes fever and hypotension, and nitric oxide causes hypotension. Complement activation is through C3A and C5A. This can cause histamine release and neutrophil chemotaxis, whereas tissue factor activation can cause DIC. Again, this was our question. And talking about toxin, these are the cytotoxin produced by E. coli, O157H7, and Cholera dysentery. They inactivate the ribosomal subunit, and they halt the protein synthesis and ultimately can cause cell death. This is the same explanation in words. We have one more question here. So which of the following is the most important bacterial virulence factor for the pathogenesis of this patient's current condition? A 3-week-old boy is brought to the emergency department with fever, irritability, and poor feeding. On examination, he is crying in his mother's arms. Temperature is 38.3. The remainder of vital signs are appropriate for age. Lung and heart sounds are clear to auscultation. Abdomen is soft. Capillary refill time is less than 2 seconds in all extremities. CSF analysis shows a leukocyte count of 600, protein of 160, and glucose of 20. Culture of the fluid grows gram-negative rods that form pink colonies on McConkey agar. Which of the following is the most important bacterial virulence factor for the pathogenesis of this patient's current condition? Capsule, exotoxin, lipid A, O antigen, or P fimbriae. So these patients with fever, irritability, and poor feeding has bacterial meningitis, a life-threatening infection most commonly caused by group B streptococcus or E. coli in neonates. In this case, the growth of gram-negative rods makes E. coli the most likely pathogen. Organisms that ferment lactose causes a local drop in pH of McConkey agar, and it is a medium selective for gram-negative organisms, resulting in colonies with a pink gray appearance. Now, different strain of E. coli have specific virulence factors that help enable the bacterium to cause disease. And in the case of E. coli meningitis, the major virulence factor is the K1 capsular antigen. We have one more question with us. So which of the following factors was most likely involved in the pathogenesis of this patient's gastrointestinal symptoms? 32-year-old man comes to the office for a follow-up appointment. The patient recently returned from a 10-day trip to Honduras, and on the 5th day of his trip, he developed malaise, anorexia, and abdominal cramps, quickly followed by watery diarrhea. The patient had 5 or 6 stools daily, but no fever. He took no medications and remained hydrated by drinking bottled water and soup. The patient felt better after 2 days and has had no additional symptoms since. He has no other medical conditions, vital signs are within normal limits, and physical examination shows no abnormalities. So which of the following factors was most likely involved in the pathogenesis of this patient's gastrointestinal symptoms? Bacterial endotoxin, cholera-like enterotoxin, intestinal biofilm production, intestinal mucosal invasion, or SIGA toxin. So this patient has enterotoxigenic E. coli causing traverse diarrhea. Now, following ingestion, the enterotoxigenic E. coli colonizes and adheres to small intestinal enterocytes. And the typical manifestations of abdominal cramping, nausea, vomiting, or low-grade fever occur due to the elaboration of plasmid-encoded heat labile or heat-stable enterotoxin. The heat labile enterotoxin, which resembles the cholera toxin in structure and mode of action, increases the cyclic AMP in gut mucosal cells by activating the adenylyl cyclase, whereas the heat-stable enterotoxin causes an increase in the cyclic GMP, as we have all discussed. Now, both mechanisms result in increased chloride secretion and decreased sodium reabsorption by enterocytes, resulting in watery diarrhea. Thank you for watching. Keep studying hard.